Hi everyone, welcome to the New Hire Benefits Orientation. Thank you for joining us today. We're going to walk you through your new hire benefits and kind of what we have to offer you here at DriveTime. So everything we're going to go over today you can find on our benefits website. It's www.drivetimebenefits.com. You can also find a lot of useful benefits information such as employee discounts and different information like that on our dash page. It's just dash/corp/benefits. This can only be accessed from your work computer, but drivetimebenefits.com can be accessed from any computer. So some important information to cover before we get into plan details. This benefits plan year is effective January 1st through December 31st. New hires have 30 days from their date of hire to enroll in benefits, and all the instructions on how to enroll and confirm your benefits can be found on our benefits website, drivetimebenefits.com. So your first steps as a new hire, you'll want to make sure you check out the new hire benefits checklist. This is going to be your guide to kind of walk you through what you need to do as a new hire for your benefits. This can be found on the website, drivetimebenefits.com, and it's also located in the DriveTime Owner's Manual. So we really want you to know who your providers are here at DriveTime. So we have many providers, as you can see, they're all listed with all of their websites and contact phone numbers. If you have any questions about these providers, you can feel free to reach out to us at benefits@drivetime.com, or you can also find all of this information on our website.
So let's talk about the medical plans, and before we do, we're going to talk about some of the medical insurance terms that we'll be using. A copay is the set amount that you would typically pay when you go to the doctor, urgent care, or ER. The deductible would be the amount of money you pay before your insurance starts to pay for a service. Coinsurance is money you have to pay for health services after you've paid the deductible and any copays. And the out-of-pocket maximum is the most you would have to pay in deductibles and coinsurance for any covered health services during that plan year. So we offer two medical plans, the Liberty Plan and the traditional plan. With the Liberty Plan, it's a consumer-driven health plan, or also known as a high-deductible health plan, with an option for a health savings account. With the Liberty Plan, you pay less out of your paychecks, but you typically pay more when you go to the doctor to receive care. With the traditional plan, that's a traditional PPO plan, you pay more out of your paychecks, but you typically pay a little less when you go to the doctor to receive care. So we want to point out that this is our 9th straight year of no rate increases to our top 2 wellness tiers. We'll talk a little bit more about our wellness program later on, but for now, those are the medical rates that would apply for the different plans. So let's talk a little bit about the Liberty Plan. The deductible is $1,300 for an individual, $2,600 for a family. The premiums are less compared to the traditional plan, and DriveTime does offer a match for those who contribute to a health savings account. It's up to $250 for an individual and up to $500 for Employee Plus coverage. Contributions into an HSA are not taxable. And with the Liberty Plan, there are no copays, which means you pay all the expenses up front until you reach your deductible, and prescriptions do need to be paid in full until you've met the deductible as well. Once you reach that deductible, you pay coinsurance of 20% until you reach the out-of-pocket max. Once you reach your out-of-pocket max, which is $2,500 for individual coverage or $5,000 for Employee Plus coverage, then you'd have no further expenses for that year, and that includes prescriptions. So a little bit more about the health savings account. Again, there's the match that the company offers, so we highly encourage you that if you elect the Liberty Plan, that you do contribute to an HSA to help you with those out-of-pocket expenses. To help with that, especially at the beginning of the year, the match is advanced. 100% is funded to your account on January 1st, or as soon as you're eligible. And it's really easy to sign up for this and receive a debit card to use for your expenses. So if you want to know what a contribution of $250 would be deducted from your paycheck, it would be $9.61 per paycheck if you were to contribute that amount. And keep in mind that you are actually saving money on your premiums compared to the traditional plan by electing the Liberty plan, so that can help offset that a little bit. So if you contributed $500, that would work out to $19.23 a pay period. And the way it works, again, just to kind of give an example, is if you contributed $250, then in January the company would give you the $250 match, and then your contribution would be funded to your account every pay period, or $9.61 per week. And on your first payday, you would have the $259.61 in your account. So let's talk about the traditional plan now. Again, this is the PPO plan that has co-pays for office visits and prescriptions. So you pay more out of your paycheck, but typically pay less when you go to the doctor. The deductible is $750 for an individual, $1,500 for a family. The co-pays are $30 for primary care, $50 for a specialist, $75 for urgent care. And with the emergency room, it works a little bit differently in that the first and second visits are $250 copay plus deductible and coinsurance. If that same individual goes to the emergency room 3 to 5 times in that year, then their copay would increase to $350 per visit plus deductible and coinsurance. If they go 6 or more times that year, that same person, then the copay would be $500 plus deductible and coinsurance. So definitely something to keep in mind. It's really just to encourage you to find care elsewhere whenever it's not a true emergency. For the prescriptions, the copays are $10, $35, $60, and then for the specialty drugs, which are the most expensive, the coinsurance is 20% up to a max of $250. And the reason for that is just because these are really expensive specialty drugs that can cost as much as $30,000 a month. And birth control is always 100% covered. So with the traditional plan, you have 2 options for a flexible spending account. The maximum for the healthcare FSA is $2,500, and you need to keep in mind that FSA is use it or lose it, so make sure you're planning out how much you plan to spend on healthcare expenses in this year to make sure that you don't lose money at the end of the year. And keep in mind that you'll need to hang on to your receipts and provide them to our vendor, Discovery Benefits, for any payments that you make with the debit card that they're going to give you that are not regular copay amounts. We want to make you aware that if you participate in the Liberty plan, you can't do a healthcare FSA because you would be doing the health savings account instead, but you could still participate in a dependent care FSA, which is for child care expenses, such as daycare. So we want to make you aware of a great benefit that we have for those who have our medical coverage. It's TeleDoc, and telemedicine means that you can call and speak with a doctor 24/7, 365 days a year. They can help diagnose and treat and prescribe medication if it's necessary for your medical issue. They could just call that prescription into a local pharmacy. So this is available at no cost to employees and family members with our medical coverage. So we want to make you aware that DriveTime is a tobacco-free campus, and we want to bring this to your attention because this is important with our wellness program, which we're going to talk about next. So DriveTime's wellness program is designed to help employees and spouses, if they're covered, identify health risk factors before they become serious health problems. And as I mentioned earlier, it's our 9th year in a row that our top wellness rates have stayed the same. So we really want to keep the momentum going with this program and keep our premiums low. So the way the wellness program works is you need to earn points to be able to save money. Your discount on your medical rates is based on how many points you earn. You'll get the discounted rate at first for the first 60 days of your coverage, but your ongoing discount will be determined by how many points you earn within 60 days of when that coverage starts. If you don't earn enough points within your first 60 days, then you can move up to the next tier once you do earn enough points. So for the gold tier, you get the best discount, and that's if you reach 2,500 or more points. The silver tier is 2,000 to 2,499 points, and the bronze tier is 0 to 1,999 points. And we're going to talk more about how you earn points. So we want to make sure you're aware that this program is voluntary, but what we're going to be asking you to do are things that are taking care of your health anyway, so why not save you some money while you're doing what's best for your health. So here are the main steps that you're going to want to complete so you can easily earn the first 1,500 points. If you're a non-tobacco user, you would indicate that on our wellness form and you'd get 500 points. If you complete biometric testing, which is blood work for cholesterol and A1C, which is a glucose measurement, you can get 500 points just for getting that done at your doctor's office or a lab. And getting an annual physical with your doctor earns you 500 points as well. So when you get the biometric testing done and your physical from your doctor, they're going to indicate your results on your wellness form. And these are what we consider the acceptable ranges for these different measurements. The blood sugar glucose, which we use the A1C test, the BMI, which is your height-weight ratio, and cholesterol. You could have either the total or the ratio that's in the acceptable range, and your blood pressure. So for each of those that you pass, you get 250 points. You can also have your doctor indicate that you get an exemption from passing one of those biometric requirements if you have a medical reason for not being able to meet the requirement, or if you're working with your doctor to manage the condition, or if your doctor doesn't consider the result to be a health risk to you, then the doctor just needs to mark the exempt box on the form or on the appeals form that you can find on the website, and will show that you meet that requirement. So this is the wellness form that you can find on our website, which again is www.drivetimebenefits.com. You can also find this on the WellTime website as well, which we're going to talk about next. So this is something that you need to print out and bring to your appointment with your doctor for them to indicate your results and send that in. So the WellTime site is where you will earn additional points, and it'll track the points that you've already earned by completing your wellness form. So this will give you a lot of information about the program, and you'll be able to participate in challenges and complete a health assessment, things that will earn you additional points. And you can also get an Amazon gift card by completing some challenges on this website as well.
Okay, so next I'm going to walk you through our dental plans. Our dental provider is MetLife, and we have two dental plans, a dental low plan and a dental high plan. The dental high plan has higher premiums, but it gives you the same coverage levels when you see an out-of-network dentist or an in-network dentist. On the dental low plan, you're only allowed to see an in-network dentist. If you're planning to use a dentist who's in-network with MetLife, you can save money by electing the low plan because the premiums that you pay out of your paycheck are lower. This year, however, for the dental high plan, we do have additional coverages. The annual plan max has increased to $1,750, and we also added adult orthodontia to the dental high plan. So if you're looking for any of those services, you'll want to make sure you elect the dental high plan. And this is a list of our dental premiums that you would pay out of your biweekly paychecks. As you can see, as we indicated earlier, the low plan has a lower premium, but that is for in-network dentists only. But the high plan has a higher premium, so you can also have the benefit of seeing an out-of-network dentist and getting the same discount. And our vision plan is provided by VSP. And you can see our rates there. It's the same plan for all employees. And I will tell you that with dental and vision, those providers do not provide dental or vision insurance cards. So when you go to the dentist or your vision care provider, make sure that you don't give them your United Healthcare card, but you let them know who your provider is, respectively either MetLife or VSP, and they can generally look you up by your Social Security number for coverages. We also have the group numbers listed on our website, DriveTimeBenefits.com, if they need that information as well. Okay, and our disability and life insurance is provided by Sun Life. For disability coverage, there are two long-term disability plan options that you can enroll in. As an employee, if you elect long-term disability, DriveTime will pay for your short-term disability. So you want to make sure you elect one of the long-term plans if you also want short-term disability. There is the core plan, which covers 5 years, it has a 5-year benefits duration, or the VIA plan, which has a benefits duration to Social Security normal retirement age of 65. These plans do vary based on, the rates vary of your premiums based on how much you make, so you will see a little variation if you get a raise or something like that. We have life insurance options as well, supplemental life insurance, supplemental spouse life, and dependent life. And here's some more information about the life insurance. All employees get a basic life insurance policy provided to you by DriveTime at 1 times your annual salary to a $50,000 maximum. You have the option to elect supplemental life insurance for yourself at 3 times your annual salary up to $450,000. Spouse life insurance, you have an option to do that. Coverage is available up to $100,000. You do have to elect to enroll in supplemental life for yourself before you elect spouse life. And then dependent life is available, coverage up to $10,000. There's a $5,000 policy and a $10,000 policy, and once again, you do have to elect supplemental life for yourself in order to enroll in the dependent life. If you are enrolling in these for the first time as a new hire, you don't have to provide any kind of evidence of insurability, but if you're going to enroll in life insurance or disability coverage outside of being a new hire, you will have to provide evidence of insurability to Sun Life. So once again, just kind of going over the disability plans. Short-term disability pays up to 60% of your salary to a max of $13.85 per week. There is a 14-day waiting period before payments begin. DriveTime does pay the short-term disability policy if you purchase long-term disability. And long-term disability is 60% of your salary up to a max of $6,000 per month. There is the core plan with the 5-year benefit duration and the VIA option, which goes to the normal retirement age of 65. And as I said earlier, rates for this election will vary based on pay. Electing beneficiaries for your life insurance plan. Even if you don't elect any benefits, you still do receive that basic life insurance policy from DriveTime, and it's really important to make sure you have a beneficiary for that policy. You can elect this in ADP self-service, and it's just important to make sure you record this so we have your wishes in the event something that would happen. DriveTime also offers a 401k plan with Fidelity. DriveTime matches 40 cents on the dollar up to the first 6% that you elect to contribute from your paycheck. You can enroll online at any time at www.401k.com, or you can call and enroll with Fidelity by phone. For more information, you can visit our website, DriveTimeBenefits.com.
As a new hire, this is your opportunity to add dependents to your election coverage. Adding dependents to your benefits, we do require documentation for medical, dental, or vision. New hires will have until benefits are effective to submit your documentation for your dependents. The Affordable Care Act requires all dependents who have medical coverage to have a Social Security number on file with any medical plan option. If you are planning to add dependents, please enter their social when adding them in ADP self-service, and for any dependents without a social, please contact the benefits department as soon as possible. So now we will go over how you enroll in your benefits. So first you will log into ADP self-service, which can be accessed from work or home. And if you have trouble logging in, please view the instructions on the benefits website. So step one will be logging in by clicking on your user login. And if you do not know your password, click on the last red bullet, which is forgot your password. Step two will be after logging in, you will land on your ADP homepage and you'll click on the Benefits tab and Health and Welfare under that. Then you will start your enrollment process by clicking on Yourself from the top menu bar, then select Enrollments. Now you will add or update your dependents information by clicking on Manage Dependents. In this portal, you will be able to add their name, their social, their birth date, and their relationship to you, and you will be able to select whether they are a full-time student or not. Next, you will click on each link you wish to enroll in, and at this point, you will make sure that you select your dependents at the bottom of the page to ensure that they are covered on that enrollment as well. Once you are done selecting all of your benefits, you will click on Confirm Elections. And if you do not click on Confirm Your Elections, your updates will not be effective and you will result with no coverage. If you have any questions, please email us at benefits@drivetime.com or visit our website. We also have a benefits phone number, which is 888-781-5654, option 1. And please view our owner's manual on our website as well for any questions. Thank you.